Hello, and welcome to this module on the psychology of addiction. Addiction is something that's rarely out of the news. Either it's some celebrity who has an addiction problem, or there's some scare about drugs, for example, the effect of cannabis on intelligence. Also, it's not just drugs that are an issue of concern, but there's also the internet, gamblings, mobile phones. So, what does psychology tell us, and what do you already know about addiction? It may be that you know something about the pharmacological nature of addiction, which is certainly one component, but what we're going to be focusing here is on the psychology of addiction. One paper in the journal Addiction mentions that there are 98 theories of addiction, which shows you that there's a lot of variation in what people think causes addiction. For example, the paper mentions that it may be too much dopamine, or it may be that there's not enough dopamine, or it could be psychosocial factors, for example, bad upbringing, too spoiled during childhood, or it may be personality issues. There may be that there are people with impulsive personality or addictive personality. Then again, there may be genetic factors. There may be social factors such as peer pressure and cultural factors, or it could be associated with abnormalities in the motivational system in the brain, or it could be things to do with social conditioning. So there are many theories, and it may be that addiction involves some or all of these processes. According to one author, just about everyone believes that addicts are driven by an irresistible compulsion, a recognized disease, but he then adds, except for those who actually know something about the subject. What does he mean by that? That's something that we're going to be exploring in this and other sessions of the module. So the module guide contains further information about each session which you should read. And in each session, what we're going to do is going to present some material in this format, and we will also, if possible, discuss one or two short handouts which I will make available to you, and also some short film segments. So let's start by looking at one very influential book that might help us to think about addiction. The book is shown in this slide, and it's called Thinking Fast and Slow by Daniel Kahneman. And the book's central theory is that there are basically two modes of thought. System 1 is fast, instinctive, and emotional, and System 2 is slower, more deliberative, and more logical. An example of System 1 thinking is when we detect that one object is more distant than another. While an example of System 2 thinking is thinking about parking in a narrow space. So the System 1 versus System 2 debate concerns the role of reasoning or lack thereof in human decision making. Here we can see more details of the two systems, and we can see that both systems have advantages and disadvantages. In terms of System 1, one of the advantages is speed of response in a crisis or easy completion of routine or repetitive tasks. In terms of disadvantages, might be that we jump to conclusions or make errors that are not detected and corrected, such as wrong assumptions, poor judgment. In terms of System 2, the advantage are that it allows reflection and considerations of the bigger picture, and it can handle logical situation. But it's slower, so it takes more time, and this can lead to fatigue. And Kahneman proposed that there are different ways that outcomes can be framed. We can think of this by thinking of an example. Imagine that you're about to purchase a jacket for $125 and a calculator for $15. The calculator salesman informs you that the calculator that you wish to buy is on sale for $10 at the other branch of the store located 20 miles away. Would you make the trip to the other store? In a slightly different version of this scenario, imagine that you're about to purchase a calculator for $125 and a jacket for $15. The calculator salesman again informs you that the calculator you wish to buy is on sale for $120 at the other branch located 20 miles away. Would you make the trip to the other store? So the two situations are really the same. Would you go 20 miles to save $5 on a calculator? When the discount was on a $15 calculator, 68% of subjects said that they would make the 20-mile trip. When the savings were applied to the $125 calculator, only 29% said that they would make the trip. So our decision depends on what features of the situation that we're focusing on. Now, there have been criticisms of this DOS experiment. For example, how many of these people actually would drive to the other store? The answer, of course, is none. There is no actual store. The subjects were asked to imagine this situation. In the absence of data on behavior, I think these results tell us not so much about what people do, they tell us about what people think a rational person would do in that situation. What's interesting then is that their ideas about rationality are themselves not so rational. So to summarize, knowing this, you could say that our system 2 helps with our system 1 type thinking. Our system 1 type thinking sends suggestions to our system 2. To our system 2. Now the thing is, on average, we make a lot of decisions every day, maybe over 30,000. And as the slide indicates down here, it would appear that the vast majority of decisions are system 1 as opposed to system 2. We don't have time to do system 2 type thinking for most of these decisions. It could be a decision, for example, to take a step to the left or the right when you're talking to somebody, or deciding to take the stairs rather than the lift, but they all occur on a daily basis. Your automatic system's primary task is to protect the system 2 type thinking. It helps to prevent cognitive overload. The problem with system 1 type thinking is that it can sometimes be wrong because it's so fast. They're really mental shortcuts, which Kahneman calls heuristics. These involve focusing on one aspect of a complex situation and ignoring other aspects. So, to summarize, you can think about how do these systems relate to addictive behavior. Is it something that's mainly involving system 1 type thinking, or is it something that involves system 2 type thinking? Let's apply some of these ideas to another decision which may be relevant to addiction. And this is from a series of studies by Joshua Greene into moral reasoning. Greene developed a situation that involved considering the following situation. First, we have the switch dilemma. So in the switch dilemma illustrated here, you can see that a trolley is hurtling down the tracks towards 5 people who will be killed if it proceeds on its present course. You can save these 5 people by diverting the trolley onto a different set of tracks, one that has only 1 person on it. But if you do that, this person will be killed. And the question is, what would you do in this situation? Is it morally permissible to turn the trolley and thus prevent 5 deaths at the cost of 1? Most people answer yes to this hypothetical situation. And Greene developed a dual process theory of moral judgments, and he asserted that moral decisions are a product of 2 distinct mental processes. The first is an automatic emotional process, which is fast and unconscious, and this gives way to intuitive behaviors and judgments. The factors affecting moral judgments of this type may be consciously inaccessible. And that's the kind of process that Greene thought was probably operating in this situation. Greene then looked at another situation, which is illustrated here, and this is called the footbridge dilemma, in distinction to the switch dilemma that we've just looked at. And in the footbridge dilemma, once again, the trolley is headed towards 5 people. You're standing next to a man on a footbridge spanning the tracks. The only way to save the 5 people is to push this man off the footbridge and into the path of the trolley. And then Greene asked people, is this morally permissible? Most people say no. So again, you're being asked to change your decision to decide whether 5 people should be killed or one person should be killed. And this creates a puzzle for moral philosophers. What makes it okay to sacrifice one person to save 5 people in the switch case, but not in the footbridge case? And this is where Greene's dual process theory comes in again. He invokes a second type of decision, which is more conscious controlled, which involves slow and deliberative reasoning. Moral judgments of this type are less influenced by the immediate emotional features of decision making. Instead, they draw from general knowledge and abstract moral conceptions combined with a more analysis of the situation. And there are many variations of the footbridge and switch dilemmas, and in fact whole books and hundreds of articles have been written on different situations depending on many factors such as, do you know the person involved? Our long-term goal is to understand these automatic and controlled processes in more details, characterizing the kind of information being processed and the neural systems that do the processing. So what we're going to look at and think about is how these processes might be related to addiction. Does addiction involve emotional processes, or in what way does it involve decision making? That's what we're going to be looking at. So let's now look at how these processes might relate to definitions of addiction. Let's look at a couple of definitions. The state of being enslaved to a habit or practice, or to something that is psychologically or physically habit forming to such an extent that its cessation causes severe trauma. Or another definition, the condition of being abnormally dependent on some habit, especially compulsive dependency on narcotic drugs. So there are a lot of elements to these definitions. Being enslaved, a habit or a practice, psychologically or physically habit forming, cessation causes severe trauma. So thinking about these words, what do they actually mean? How does the habit form? Is it the result of decision making in particular situations? There are many questions involved in these processes. The most obvious answer, and the one that most people might give, is that the drugs themselves cause the addiction, rather than the more psychological approaches that we have looked at. If we look at earlier definitions, we can see that the word was not always used in this way. So if we look at the earlier definition, it's more of a tendency to do something. You can see the Latin roots of it here. So the earlier sense was less severe. It was more of an inclination to do something rather than a compulsion. The modern use of the word derives later from, in fact, the turn of the 20th century in relation to opium. We can see that in all these definitions, the central issue concerns control or self-control. To what extent are we deprived of the ability to control our behavior? So think back to the discussions that we've had looking at the way in which people make decisions about situations. We can also understand the processes involved by looking at how people talk about addiction. Let's look at some examples of how the word is used in everyday speech and think about what we can learn from this. So in the first example, the statement reads, Tom is addicted to the internet. Can we learn anything about this? Is it something about Tom, or is it more something about the internet? Or is it the process of when Tom uses the internet, he becomes addicted, and if so, in what way? The second statement says Tom is a TV addict. Again, is it Tom or is it the TV that's causing the addiction? The third statement reads, I'm Tom and I'm an addict. That's a stronger statement. It's saying something about Tom. It's something about perhaps his personality that leads him to addiction in different situations. The next statement reads, fast food can be addictive. So it's not saying that fast food is always addictive, but in some situations, or perhaps for some people, fast food can be addictive. The next statement reads, Tom had to undergo rehabilitation. That's suggesting that there's something about addiction that requires rehabilitation. And finally, the last statement reads, when Tom was a boy, he was addicted to reading detective stories. So that's bringing in a completely different aspect of addiction, which is more of a positive aspect of addiction. So if we think about all these ways in which addiction is used, we can think about, is it something about the person? For example, some people have addictive personalities. Is it something about the activity? For example, eating certain types of food or using the internet? Is it something to do with the consequences of these activities, the way in which we feel good or bad? And again, we can also think about the relationship between language and addiction. To what extent is language actually framing our understanding of addiction? And finally, what is required to help people to stop being addictive? Does it require rehabilitation? So we can see in all these statements the importance of language in thinking about addiction. So normally when everyone is in the same room, I ask you all to think about what images come into your mind when you think about addiction. And we can see from the word cloud here the many different ways, many different types of things that people think about when they think about addiction. Sometimes it's to do with things that are associated with addiction, like smoking cigarettes, alcohol, gambling. Sometimes it's more to do with processes that are associated with addiction, habit forming, being enslaved, out of control. And finally, there are a set of images to do with the effect on brain functioning. One of the things about addiction is that we have access to so many things in modern society that are reinforcing. And perhaps another aspect of addiction is to think about why we find it difficult sometimes to moderate our behavior. For example, a study in 2010 of iPhone use of 200 students in America, 44% reported that they were completely addicted. A quarter said that they found their phones dangerously alluring, and many said they lived in a constant state of anxiety about their phone battery levels. So is it just the effect of things on the brain? Some heroin addicts will still report that the drugs have an effect even when the heroin that they're being given is a placebo and doesn't have any heroin in it. So it's been argued that to some extent addiction could be a self-fulfilling prophecy. In talking about food addiction, one commentator said that the word addiction, in her view, is not helpful because it can deflect focus on the causes of overeating from the person to the environment. For example, that foods are addictive, so this creates food addicts. So as we mentioned before, there are many different ways of thinking about addiction. Let's look at these issues in more depth and look at these questions. First of all, how does a person become addicted? One aspect is the progressive replacement of people and activities with things. Why? Well, objects are more dependable than people. Wanting and liking are separate urges controlled by different parts of the brain, and this is discussed in the incentive sensitization theory. This posits that the essence of drug addiction is excessive amplification of wanting, especially triggered by cues, without necessarily an amplification of liking. And this is due to long-lasting changes in dopamine-related motivational systems of susceptible individuals called neural sensitization. A quarter century after its proposal, evidence has continued to grow in support of this theory, and its scope is now expanding to include other behavioral addictions and other psychopathologies. So we can see here a linking of psychological and brain processes. The second question is, can everyone become addicted to something? And this is an area of contention. Some people think that yes, everybody has the potential, and other people think that it's only certain people that are susceptible. One thing that we can think about is that sometimes there may be underestimating the importance of the situation and the context in which people display addictive and behaviors. And the third question is, can we stop ourselves from being addicted, and in what way? Psychologically and behaviorally, there's a paper by Avina and Talbot which argues that it's much easier to enact small changes over time than to try to jumpstart our behaviors. This is with regard to eating patterns. They cite a study that compared a 20-week diet with the same program implemented gradually over 40 weeks. People in the 40-week group lost more weight and were better able to maintain their weight loss over time. They point out that if you try to teach a dog a complicated trick in one go, learning might never occur. Whereas if you teach one step and then start rewarding, it will eventually learning. And this strategy is called shaping. That's just one aspect that we might want to think about in terms of how do we stop ourselves from displaying addictive behaviors. These ideas of different psychological or brain systems are not new. A key figure in developing these ideas was Sigmund Freud. Freud's most enduring and important idea was that the human personality has more than one aspect. Freud described the mind in terms of three parts: the id, the ego, and the superego, all developing at different stages of our lives. These are systems, not parts of the brains or in any way physical. The id is primitive and is the instinctive part of our personality. It consists of inherited or biological components of personality, including the life instincts. The second part is the ego. The ego is that part of the id which has been modified by the direct influence of the external world. The ego develops in order to mediate between the unrealistic demands of the id and the external real world. It is the decision-making component of the personality and is sometimes called the reality principle, in distinction to the pleasure principle which governs the id. And the superego incorporates the values and morals of society which are learned from one's parents and others in society. And the superego, in Freud's view, consists of two systems: the conscience and the ideal self. The conscience can punish the ego through feelings of guilt. For example, if the ego gives in to the id demands, the superego may make the person feel bad through guilt. A person's development is developed by events in early childhood and human experience. And these conflicts between conscious and unconscious or repressed material can materialize in the form of mental and emotional disturbances. The liberation from the effects of unconscious material is achieved through bringing this material into conscious life via therapeutic intervention. So there are a lot of interesting ideas that Freud developed. As we'll talk about later, not everybody agrees with these ideas, but they may be of interest when thinking about addictive behaviour. Let's look at a short extract from an article from the BBC website which brings into focus some of these issues. The article is entitled Who, What and Why? How is Keith Richards Still Alive? Keith Richards is the Rolling Stones guitarist and songwriter. And the article says that he acknowledges that his wealth allowed him to ingest a higher quality of substances than the typical drug users. But he adds, I was very meticulous about how much I took. I'd never put in more to get a little higher. It's the greed involved that never really affected me. People think once they've got this high, if they take more, they're going to get a little higher. There's no such thing, especially with cocaine. Maybe that's a measure of control, and maybe I'm rare in that respect. So why Keith Richards and not other people? And what does he mean by measure of control? As we've seen, this idea of self-control is central to concepts of addiction. And here's another example for you to think about. This is from another website article. And the article says, this summer, a mother I know told me that her 12-year-old bookworm daughter had regretfully handed back her Kindle Fire, saying she couldn't handle the temptation to play games rather than read. Her mother was stunned. She assumed that all those hours in the Kindle were being spent poring over the summer reading list. It turns out her daughter couldn't resist doodle jumping her days away. I was impressed that a young girl could admit this growing addiction and handle over her Kindle, but that's the exception, not the norm. Most parents are slowly recognizing that what starts out as an innocent distraction and a fun way to integrate technology into their lives can easily turn into a full-blown addiction. Another paper that touches on aspects of this states that for the addict, the prospect of giving up his addictive behavior and the feeling that it brings activates profound feelings of loss, deprivation, and despair. These seem like deeply emotive ideas. So these are deep emotional ideas, not just surface ideas that can be easily dealt with. The addict is attached in a primitive and pre-rational fashion, just as we discussed in relation to Freud. So is it the case that the addiction is more like the footbridge phenomena, where the reasoning part of the cognitive brain is overtaken by emotion? Something else that we need to explore, and we have touched on already, is the psychological and pharmacological aspects of addiction, and ask whether the current explanations we have are correct in the balance between these two aspects. Somebody who's argued strongly that there's too much emphasis on the pharmacology and not enough on the psychology is John Davis in his book, The Myth of Addiction, which might be called The Myth of Pharmacological Addiction. And you can read extracts of the book at this website shown below here. There are many strands to John Davis's argument. We'll just look at some of them here. First is, if pharmacology explained addiction, it would make predictions much better than it does. So yes, we do know a lot about the pharmacology of brain processes in relation to addiction, but we're not very good at explaining, for example, why some people find it difficult to give up and others don't. He argues that there's an illogical dichotomy between people whose behavior is governed by pharmacology and people who make decisions. This is something that we touched on already, this idea of self-control or lack of self-control. He also argues that finding a correlate of something does not explain why people do something. Many things that we do have correlates in the brain, but it doesn't explain why we do them in the first place. His argument is that in the case of drugs, what we've done is we found the effects rather than the causes, which is what we need to focus on in terms of understanding addiction. I'd like to look at another concept that is illustrated in this quote from the book Living with Drugs by Michael Gossip. Gossip says, if an addict believes that he is totally helpless before the power of heroin or whatever drug it might be, then he is indeed helpless. But the origins of the helplessness lie in the psychology of the addict and not in some chemical property of the drug. So that's obviously very important because again it relates to this idea between the psychological and physical aspects, the pharmacological aspects of addiction. So Gossip uses the word the feeling of helplessness, and it's interesting in this concept to look at somebody else who studies helplessness and specifically learned helplessness. Famous experiments by Martin Seligman showed that how helplessness can indeed be learned. Seligman was interested in depression, and one of the experiments that he did is illustrated in this picture here, where you can see a dog in a cage, and what this illustrates is an electric shock, and the idea is whether the dog is capable of learning that if he jumps over this barrier he can escape the electric shock. And what Seligman found was that in certain situations the dog is capable of learning that he can jump over, but sometimes he can't learn this association, and that could be of relevance to addiction if you feel that you can't escape a situation. So in the first part of the experiment, 3 groups of dogs were placed in harnesses. Group 1 dogs were simply put in the harnesses for a period of time and later released. Groups 2 and 3 consisted of yoked pairs. Dogs in Group 2 were given an electric shock at random times, which the dog could end by pressing a lever. Each dog in Group 3 was paired with a Group 2 dog. However, when a Group 2 dog got a shock, his paired dog in Group 3 got a shock of the same intensity and duration, but its lever did not stop the shock. To a dog in Group 3, it seemed that the shock ended at random because it was paired with it was his pairing with group dog in Group 2 that caused the shock to stop. Thus, for Group 3, the shock was inescapable. In part 2 of the experiment, the same 3 groups of dogs were tested in the apparatus shown. All the dogs could escape the shock at one side of the box by jumping over the low partition. The dogs in Group 1 and 2 quickly learned the task and escaped the shock. Most of the Group 3 dogs, which had previously learned that nothing that they did had any effects on the shock, simply lay down and whined when they were shocked. This is a dramatic example of the retardation of learning that typifies learned helplessness. So when we see Gossip talking about this feeling of helplessness, we here have an explanation of how helplessness can be learned using psychological experiments. So what is addiction then? We've looked at many aspects that might be relevant to addiction. If you go onto many websites, for example this one here, and it asks addiction potential is a property of what? The drug, the individual, or the situation and circumstances, and it argues that the common factor that has been identified is the drug rather than anything to do with the individual or the situation and circumstances. But we've already seen that people can be addicted to things other than drugs, for example, gambling and the internet. So arguably we could ask whether this neglects issues of context and other factors that we've been looking at. And here's an example from another website called Addiction Science, which argues that some important characteristics of a drug's action is critically important in producing an addiction. Attempts to look at other things such as personality, social environment are less successful. So what we're seeing here is a distinction between explanations which focus on the pharmacological aspects of the drug and those which focus more on psychological aspects of the drug. But there are certainly many places which only focus on the pharmacological aspects of the drug or other addictive behaviors. We're now going to look at the diagnosis of addiction, or as it's more usually called nowadays, dependence, although the term addiction is often used as well. And this definition comes from the American Psychiatric Association's Diagnostic and Statistical Manual, usually called DSM-4, which was published in 1994. It's quite a complicated definition, and I'm not going to go into all the details here. But it's important to note that there's a mixture of pharmacological and psychological factors. So the previous definition, which is the 3 points in italics here, is more to do with pharmacological aspects, tolerance, marked decrease in effect, characteristic withdrawal symptoms, and the need to take more and more drugs to get the same effect. So these are pharmacological, but now we see more addition of psychological aspects of addiction. And you can see that to meet the diagnostic criteria, you require 3 or more of these in a 12-month period. So you can be diagnosed with having pathological dependence based only on pharmacological or only on psychological factors, or a mixture of the two. In 2013, DSM-5 was published, and there's a slight change in the classification. DSM-5 does not separate the diagnosis of substance abuse and dependence as in DMS-4. Rather, criteria provided for substance use disorder accompanied by criteria for intoxication, withdrawal, and these other factors. So again, it's a complex definition. Cannabis withdrawal is new for DSM-5, as is caffeine withdrawal. Of note, the criteria for DSM-5 tobacco use disorder are the same as those for other substance use disorders. DSM-4 did not have a category for tobacco use. The severity of DSM-5 substance use disorders is based on the number of criteria endorsed. 2 to 3 criteria indicate a mild disorder, 4 to 5 criteria a moderate disorder, and 6 or more a severe disorder. Let's look at this issue in relation to nicotine. So the key question is nicotine addictive? And these facts about nicotine are taken from this website down here. And it argues that the core of the addiction over dependence is the loss of control over use. The drug controls you, you don't control the drug. So here we have one of the psychological aspects of addiction or dependence being discussed. Specifically, you're not able to stop using when you decide to. You use the drug despite clear evidence that it is harmful, and there are clear withdrawal symptoms, including in the case of nicotine, depressed mood, insomnia, irritability, and difficulty concentrating. And in brackets I put questions for you to think about in relation to what these statements mean. While there may be loss of control, remember the Keith Richards quote that we looked at earlier. What exactly does loss of control mean? And in thinking about nicotine in relation to other drugs such as alcohol, heroin, cocaine, it doesn't actually cause addiction. So in what case, in what sense is it addictive? Is it the case that nicotine is more likely to entrap users than addictive drugs that actually cause intoxication. It's been argued that if 100 people experiment with alcohol or cocaine, about 10% will become addicted versus 20% of those who take up nicotine. And here are more reasons why this website states that nicotine is an addictive drug. Another reason why nicotine is likely to produce dependence is the drug's ability to do, quotes, so many things in so many situations. So again, here it's looking at the functions that nicotine performs, psychological aspects of addiction. Since many of these effects, controlling hunger, concentration, are exactly what many adolescents seek, and since the drug does this reliably, it's no wonder that many children take up smoking. Not everyone agrees with this view of addiction, however. This website here states that the anti-smokers whose goal is to control unacceptable behavior exaggerate the concept of addiction in order to generate a feeling of guilt so that smokers will accept and tolerate the anti-smokers' intrusive intolerance. So we've already seen that the complex of addiction or dependence is complex and quite often reliable on what people say about their addictive behavior. The website also goes on to say, of course, once the floodgates of mislabeled addictive behavior are opened, it becomes possible to intensify control other behaviors as well, overeating, drinking. So we can see that the conception of dependence and how we define it is very important for understanding whether behavior is addictive or not. This website also looks at other aspects of nicotine and asks, is smoking cessation therapy effective? And it states that yet another study discovers the obvious: smoking cessation gadgets don't work in the long run. Why? The answer is simple: nicotine itself is not addictive and smoking is a habit. The habit, like all behaviors, is psychological, not physical, and it is exerted through association. And it goes on to say that this view of smoking is of course blasphemy nowadays, for everybody says that nicotine is addictive. So we can see two very contrasting views of whether nicotine is addictive or not. This slide provides reasons for why smoking cessation programs are effective. It's a difficult area to research, and as we'll see here, this slide looks like there are many processes involved. Firstly, involving the physical mind, which needs time to resensitize itself. Secondly, the subconscious mind needs time to encounter and re-encounter nicotine cues that triggered brief anxiety episodes. And thirdly, the conscious mind needs time to allow years of dependence rationalizations to fade. So we can see here very much the different levels of the mind or the brain that we've looked at in relation to, for example, Sigmund Freud, that are involved in both the processes of establishing and overcoming addiction. So, in summary, there are two views of smoking cessation, depending on one's definition of addiction. And clearly, they both can't be correct, because as we'll see, they involve very different approaches to smoking cessation. The first approach, which is encapsulated in the NICE guidance entitled Stop Smoking Services, notes that recommended treatments that have proven to be effective include pharmacotherapies such as nicotine replacement therapies and psychotherapies such as behavioral counseling. And in this view, nicotine is physically and or psychologically addictive. The second view, which sees smoking more as a psychological process, which may or may not involve ideas of addiction or dependence, the findings suggest that most successful ex-users quit cold turkey, in other words, without any form of treatment intervention at all. And in fact, this method is more successful than all other methods combined. For example, a 2006 Australian survey of 8,000 patients found that cold turkey was twice as effective as NRT. It also found that cold turkey accounted for 88% of all successful quitters. The final topic that we'll look at in this introduction is medicinal cannabis and other psychoactive drugs that may be used in therapy in the future. Clearly, these are of interest to pharmacists. As the slide illustrates, there was changes in legislation in 2018 that widened access to cannabis-based products, and clearly the pharmaceutical industry is taking a big interest in the use of medicinal cannabis in terms of looking at drugs that they may add to their portfolio. The idea that the use of prescribed psychoactive drugs to control mood may become more prevalent is a feature of the novel Brave New World by Aldous Huxley, published in 1932. In Brave New World, soma is a kind of opiate that causes people to feel happy so they don't need to concentrate on reality. Some of the characters in the novel take soma with their coffee, for example, before they go out. People are so used to taking soma that they find it impossible and frightening to face life without it. In Brave New World, soma is used to maintain social order and keep people from feeling negative emotions such as jealousy, depression, sadness, or anxiety. Brave New World is a fiction, but it could be that society is moving in direction. In terms of what we've already discussed, would you consider soma to be an addictive drug? And is that something that we should be concerned about? So that ends this introductory session, and we're going to be exploring these ideas in future sessions.